Hello, everyone. Well, we have been talking about holistic lifestyle. Today, what we want to do is talk about how natural therapies can help all of us prevent, reverse, and cure chronic conditions and all kind of other ailments. While we'll talk about this particular topic, we have Dr. Stuart. Dr. Stuart has been a naturopathic doctor and holistic nutritionist for the last 4 decades. Before anyone even knew what naturopath doctor is or anyone even knew what holistic nutritionist, she has been the proponent of that. I am so super excited and honored to interview her, and she's joining me live today. Thank you so much, Dr. Smith, for being with me.
Thank you for having me here, Amita. I appreciate that. Well, I'm really happy to share a lot of the information I have. I'm going to give you some really great tips of what's going to help you. This is a holistic health program that's going to help you in wellness in different aspects and what you can do for it. Holistic health and naturopathic medicine is a way of treating yourself holistically and getting to the root cause of what is your problem rather than band-aiding it, which is very important. When you take a pharmaceutical drug, it's going to help you to some degree, but it's not always going to cure you. You go off of it and the problem is still there. So that we call a band-aid. It's nice when a drug does work, like an antibiotic or something, but that doesn't always happen. People are dependent on many different pharmaceutical drugs. And our idea as a naturopath is to look at the holistic approach and getting to the root causes. So at Naturally Balanced Health, we follow a number of different protocols that I believe are going to work best. We start off by looking at the whole person. One of my favorites is looking at solar nutrition, or also known as chronobiotics, dealing with the circadian clock of the human body, which means that if I go back a little bit, solar nutrition has been around for over 10,000 years. It helps us understand when to eat what foods we should be eating because of the quality of the food, and when it's taking in maybe the pesticides that are actually being sprayed on it, or each plant has a way of preventing itself naturally as a pesticide prevention, eating the right foods. Also, in this particular aspect, when we know what time somebody's birth is, that helps us to help them understand what might possibly be the weakest organ that could be coordinating to whatever their health problem is. Let's say, for example, you're born, or the person you know is born somewhere in the neighborhood of between 5 a.m. and 7 a.m. And that's biological time that we're speaking of, not daylight savings time. We're talking biological time, which would be standard time at that moment of your birth. So at that time, the organ that is at its point of time is the large intestine. So it would not be odd for you to be starting to have maybe colon problems, constipation, diarrhea, belly bloat. When you start having those problems, we know that the diet is the primary cause of this. And we have to get to the root cause of what you're putting in your body that's causing these problems, because every single person must be treated individually. Many years ago, when I wrote and did my audio book, I realized that there were many different body types out there, thinking there was only 32. And after my book was published, I said, oops, I think there's 172. And then after the second edition came out, I said, oops, and I did my mathematical equation on it. And brace yourself, there are over 43 billion. 358,978,720 different body types. Well, how can that be? There's only 7 to 8 billion people in the world. Well, it is true. We go by many different variables that I put together and came up with that number, because we are interested in looking at you as a whole person to prevent, reverse, and cure. So what that means is we need to know, what's your blood type? What's your Rh factor? What's your gland type? What's your dosha type? What's your ethnicity? And many other categories that we would like to and dearly take care of you with to help you improve your health. So that time of birth is very important to be able for us to help you. And it's not just that large intestine, it also has an opposite organ that has a weakness to it. And we would go more into that. And then 2 other organs that could be affected. Plus, let's say you get sick and it's a Tuesday afternoon and it's 4 o'clock and you start feeling really lousy. If you know what time it was that you started getting sick and you tell us, we can probably have an idea of what organ is directly connected to that. And we can say, there's a weakness going on here. And so we work with that variable. We also like to work with the blood type. Now, a lot of people have heard of the blood type diet. Believe it or not, it's been around since about the latter 1940s, but never really took off. There was other people that had written information about it. And then eventually 2 other doctors came on board in the 90s and wrote 2 books on it at that time. The blood type is almost like having a testing for what you might be allergic to or have an allergic reaction to, because an allergy means it's life-threatening and an allergic reaction means there's an actual reaction, but it's not life-threatening, kind of like a rash or an itch or swelling, something that's uncomfortable, but it's not life-threatening. That would be an allergic reaction. So by knowing your body's blood type and adhering to the foods that are beneficial based on your blood type and the RH factor is whether you're a secretor or a non-secretor blood type. The positives are called secretors and the negatives are non-secretors, which means that the bodily fluids in a negative blood type, their fluids don't necessarily mingle together on some way, whereas in the secretor they can. That's why, say, someone who is a O blood type, let's say, if they're a positive blood type O, they're not supposed to do any coconut oil. But if they're a negative O blood type, they can do it in a small amount. They can do that because it's not considered beneficial, but it's okay. And that goes through the whole series, and we work with our patients on that. So they have some way to start helping themselves by starting by eliminating the very foods that have a negative effect on their blood antigen, because each food has lectins and agglutins in them. And when you consume a food, say you're an O or an AB or an O or a B blood type, okay, all of you can't do most of them corn or corn products or wheat and things like that because of the sensitivity to the blood type antigen, which will have a negative respect. And one of the things it's going to cause is if you do wheat and corn, it's going to cause an enormous amount of bloating and it's going to get you stuck up. And one of the things you can think about is that when you take flour and water, you make paste. And you put that in your body and it's going to be sticky in there like glue. So you want to be very careful of what you're choosing, which brings us back to nutrition, okay? And when we're dealing with our health, the most important thing is your nutrition, because we know that well over 90+% of our health problems are derivative from what you're putting in your mouth. What are you eating? What are you drinking? Are you doing it in correct food combining? Because when you do incorrect food combining, you're going to set yourself up acid reflux, indigestion, belching, gas, flatulence. All of these things are going to be systematic symptoms of what the problem is. And the problem goes back to what you're putting in your mouth. So we have to get back into the basics of nutrition to help you understand. Look, if you've got this problem, we can help you reverse it by making all of these different changes. And then that's going to prevent you from having the problem, and you can be cured by doing what your body needs rather than giving into your emotions and mentally. It's like one of the most important things to know about a specific food that probably most of the American population does in overdose, and that's sugars. Sugar is considered a poison. Sugars are white sugar, brown sugar, turbinda sugar, raw sugar, cane juice, molasses, honey, maple syrup, corn syrup, rice syrup, agave, and fructose, which, by the way, fructose is no longer made from fruits. It's made from corn. And most people don't know that. It is very important to understand a little bit of sweetener is okay. But if you start paying attention to your daily eating habits, you're going to be noticing that you are overdoing it. And that sugar is going to cause you to have inflammation. It's going to cause you to have body swelling. It's going to cause you to maybe have foggy memory, because we know in science, we know that when you're doing a lot of sugars, it's going to be a trigger to having memory loss, which can lead to dementia, can lead to Alzheimer's or Parkinson's because of the memory aspect. Whereas when you're eating foods that are more bitter, they enhance the memory. Bitter foods can be like cilantro and parsley and turnip greens and so forth. There's many foods that fall in. Plus, of course, your nuts that look like the brain, they're considered a brain food. So there's a lot that you can learn on how to take care of your health by understanding a food. In fact, a lot of foods look like the organ that they are beneficial to, that we share with our patients. Hey, what organ does this look like? For example, if you look at a stalk of celery, if you really look at it, it looks like a bone, the way it has the striations in it, and it's good for bone health and so forth. And you can see that with many different types of foods, that they fit that category, eating foods at the right time of the day based on solar nutrition, which means that in solar nutrition, you would like to eat in the morning things that are going to receive the energy from the sun in the morning time, which are going to be foods that grow high in the trees, you know, the apples and the pears and the peaches and the coconuts and all of these things that are growing high. Whereas you wouldn't be eating berries in the morning because they don't grow high in the tree. That would be more of an afternoon food. But your nuts and most of your high tree foods would be a morning food, and they're going to give you the nutrition. Whereas if you eat a morning food in the afternoon, when it's naturally putting off its anti-pesticides, you may be getting more of that in your body than that real good nutrition from the food itself. Also, when you're dealing with sugars, you're setting yourself up for a faster aging process. And who wants that other than a kid under 10 years old? They're the only ones in a hurry to grow up. That's what's really important, to be able to know how to gear yourself with nutrition. When we're dealing with nutrition, I want to take this another step further. In one of the type of testing that we believe very firmly in is doing the LA testing. The LA testing gives us a view by testing the soft tissue of the body. The soft tissue is going to be taken from your skin or your hair in order to determine how much of these minerals are being stored in your soft tissue over a period of time. And that storage can last 3 to 4 months. Whereas when you're having blood work done, you're seeing what your levels are today, tomorrow, whatever it is. But what's being stored in the soft tissue is literally going to cause competition among the minerals. And that test also reveals to us the heavy metals. And we can see how the toxic metals are also playing an act in how it's affecting the minerals in your body. So, for example, this is a really important feature. Women come in and they say, I know I have hormone problems, and my doctor says I need to be on this particular remedy. I said, okay, have you had a hormone testing? If they said yes, that's great. If they haven't, then we suggest doing that. But even before that, we would much rather them doing the mineral testing before the hormone testing, because your minerals literally compete with each other. And they also partner up with each other. For example, calcium and magnesium work like a partner together. However, they should not be taken together, and yet still packaging goes calcium and magnesium together. This only came across the read I want to say about a year ago, that they shouldn't be together. And I knew that years ago, because when I was looking at these charts, I realized calcium and magnesium do compete with each other. Now, calcium and magnesium are the underdogs of the thyroid gland. And the thyroid gland is being controlled by your calcium and your magnesium. So if you're having imbalances with them, you're going to have thyroid problems. And when you have thyroid problems, you probably already have adrenal problems, and vice versa. Whereas the adrenal glands are associated with another two minerals. And so we have to look at them, because that particular gland is also affecting the hormones. And we can see there are issues going on here. So we recommend, let's do the mineral testing first so we can get you eating right. Then when we down the road we test you, we can get a more accurate feature of what you really need to be doing. Because maybe we can fix the problem just with your dietary habits, which makes more sense since you have to eat every single day. Well, maybe not. You can go one meal a day and maybe one meal the next day. Everybody's body is different. So the most important thing to remember is, now we've got down to the hormones and we go, okay, we check the minerals, we get to the hormones. But what most people don't know, and I hear this, even gynecologists don't even mention this, your hormones are out of balance. The number one cause, other than the minerals, the secondary number one cause why your hormones are out of balance is because of the insulin in your body. And what's triggering the insulin? Oh, that little poison out there called sugar. So we're right back where we started from. And we have to look at this whole picture with the patient as to what's going on with them. Why are you causing these things to your body? What is happening? Rather than being fed a drug, perhaps we can reverse this completely by us finding out over a period of time what's going to work best for you. And the same thing is true whether you're a man or woman. We definitely do the hormone testing for both. But we want you to be able to look at the whole picture of what can be done to help you help yourself as we guide you down the road, plus making you accountable. Because back in the 70s, I created this journaling technique when I was working with Jack LaLanne, and I was using it for myself, and then I gave it to my clients. And I've certainly made it much more detailed today, that I insist that my patients keep these journals so I can help them on a weekly basis to help them see what they're doing correct and where they need help. And then I tell them to hold on to this book, because if they fall off the wagon, so to speak, they know where to go back to get their own information. And it's their own little diary of helpful suggestions and knowing where they made mistakes and how to improve themselves once again. All of these and so much more are ways to help the body literally prevent, reverse, and cure yourself from various ailments that are going on.
Beautiful, absolutely beautiful. The way you described it, it's a very simple way, and the same principles apply to all the ailments. It doesn't matter whether someone, right? Someone's suffering from hormone issues or some cancer recovery or anything else. That's the beauty of the holistic medicine, is all taking the mind, body, and soul together. It's not just, okay, this is the compartmentalized, right?
Exactly. I mean, I definitely bring spirituality into there. That's not religion, but we have to recognize our soul and do what we need to do for ourselves. We have to learn to listen to our body. And I really like teaching people how to pay attention to their soul. Really listen to your body. This is how I learned a lot of things, because I was always paying attention. One of the things was I went to my dentist one day, decades ago, and I said, I'm having a problem with my teeth and my jaw. And she said, oh, I can do this and this and this for you. And I walked out of there going, I wonder if maybe I'm deficient in something. And I went to the health food store and started. And I'm sorry, I'm being repeated. Here.
Oh, that's okay. Don't worry about it. I think this is a quick 10-minute session that we wanted to bring today.
Okay, good.
And thank you so much. Yeah, absolutely. Thank you so much. The whole idea, the intention of this particular session, what Dr. Stuart wanted to point out was that, how do you prevent, reverse, and cure using simple principles which she has described that can be applied to any ailment, and how nutrition is so critical and personalized for you. And you can do that personalization by using some simple testing that she talked about. And that testing is also actually taught in Ayurveda, or we are talking about genetic testing now, we're talking about mineral testing. This concept has been there for 5,000 years now. It's just validating it with the research, and you can fix a lot of ailments inside your body by just using nutrition to understand your body, what to eat according to your constitution, according to who you are, right? And there's a lot of things more that we can talk about, but for today's session, I think this is more than enough information for people to digest. And thank you so much.
Okay, thank you.
All right, thank you, everyone. And we will be back with Dr. Stuart on a completely different topic. Thank you. Bye-bye.